You're listening to Be Health Connected, a podcast by the St. Louis Area Business Health Coalition. Your host for today's episode is Annie Fitzgerald, BHC Director of Member Engagement and Health Solutions.
Hello, I'm Annie Fitzgerald, and welcome back to the BHC's Be Health Connected podcast. In today's episode, we're pleased to be joined by Neil Goldfarb, who is the president and CEO of one of our sister coalitions, the Greater Philadelphia Business Coalition on Health. While the Philadelphia Coalition is widely known for its initiatives on obesity and diabetes prevention, today we'll discover their recent expansion into addressing another pressing concern, hypertension. Join us as we uncover the innovative strategies that employers can adopt to improve the quality of care for their employees with cardiac conditions. Neil, thanks so much for being here.
Hi, Annie. It's great to be here. Thanks for the invitation.
Well, we're happy to have you. As I said, as a sister coalition, it's always nice to, share the great work that you're working on. I think as we mentioned in the intro, your organization is often recognized for its efforts in obesity and diabetes, but could you share some insights into why your organization decided to branch into addressing hypertension as well?
Sure. So we are a coalition for Southeastern Pennsylvania, Southern New Jersey, and Delaware. And our mission is to help our employer members figure out the best ways to keep the workforce healthy or improve the health of the workforce, improve the health of the community, and improve the value of the benefit spend. And so we're always looking at what are the major conditions that we can have an impact on that will help improve health and lower costs of care. And hypertension definitely fits on that list. The way we came to hypertension was actually a little bit fortuitous in that the CDC Foundation had reached out to us asking if I would be willing to talk to the National Hypertension Control Roundtable about the work we were doing in benefit design for obesity, and to start to think about what are analogs to work we might do in the hypertension space. So we took that challenge up, and then we were able to get some funding from the CDC Foundation to really flesh this project out. I know we're going to get into more of the details, but I'll just say that the more I looked at the literature on the impact of hypertension, the more convinced I was that as an employer coalition, we had to address this very prevalent chronic condition.
Certainly. And, that public health and business partnership is, I know, something that the CDC Foundation has really been trying to expand their work in that space, over the last few years. So I think it completely makes sense to partner with an organization like that to bring this to employers. We talked about hypertension and, the fact that it's really a significant health issue, affecting millions of individuals, across the country and also worldwide. But can you provide some perspective on, the prevalence and economic impact, particularly for the workforce?
Sure. So let's first talk a little bit about prevalence. As with any disease, there are many different studies that estimate its prevalence in the US population and the global population. I think the best statistics say hypertension affects nearly half of Americans, 48% of Americans. Now, there is an increasing prevalence by age. In the workforce, most studies would say that the prevalence of hypertension is somewhere around 40%. Now, I just want to put that in perspective. That is higher than the prevalence of obesity. That is much higher than the prevalence of diabetes, which is around 10%. Now, when we talk to employers, almost every employer has a diabetes strategy in place to some extent. Diabetes prevention, diabetes management, maybe a vendor, maybe coaches or counselors. But very few employers have hypertension strategies in place. And so we want employers to recognize that this is a pervasive chronic disease that affects almost every other major disease. So when I ask my employer members, what are your biggest challenges from a prevalence or cost perspective? We almost always come up with the same list. Cardiovascular disease, obesity, diabetes, musculoskeletal conditions, maternity care, mental health, and oncology, in some order. Well, there is not anyone on that list that is not affected by hypertension. So I think some people think of hypertension as cardiovascular disease, and it absolutely is cardiovascular and cerebrovascular risk. But it affects almost every other disease, the likelihood of getting that disease and or the impact of that disease on the worker. So even cancer, musculoskeletal conditions, if you think about hypertension, it is so prevalent and has such a big impact on health and all organ systems. We absolutely have to address this public health crisis. The other thing I wanted to say about prevalence is we need to keep in mind that hypertension disproportionately affects people of color. And everybody, I think, is dealing right now with diversity, equity, inclusion, and health equity, and social determinants of health. And so we need to recognize that in the United States, Black or African American people are more likely to have hypertension, are less likely to have a primary care relationship, are less likely to have good access to care, are more likely to face significant challenges financially in paying for care. And we need to address that. So if we're going to address hypertension, we also need to be on the lookout for how can we reduce inequities in care. Now, regarding the economics of hypertension, from an employer perspective, it's been estimated that employees with hypertension cost somewhere between $2,000 and $3,000 more per individual than people without hypertension. That is really dramatic. So go back to the prevalence. Half the workforce has hypertension, and each of those people costs $2,000 or $3,000 more. You can do the math and very quickly say that hypertension for mid-sized to large employers is costing millions or tens of millions or hundreds of millions of dollars each year. And so we really need to be stepping up our game and addressing it.
Certainly. I mean, it's truly, by having a hypertension strategy, you're really impacting the root causes of many of those comorbid conditions that you mentioned, obesity, diabetes, MSK conditions. So it's definitely important. And we've really made the case, I think, for why it's important for employers to have some kind of hypertension strategy. So amongst your employer members, have you observed, an active engagement from employers in tackling hypertension?
So when we first became interested in hypertension and started to talk to the CDC Foundation, I reached out to many of our employer members and asked them, what are you doing about hypertension? And by and large, there was no answer. A few of our employer members who had a vendor in place for diabetes management had also purchased that vendor's hypertension module. But by and large, the employers said, haven't really thought about it, or it's not really on our radar currently. Tell us more about why we ought to adopt a hypertension strategy. So I think the employers who are out there doing something about hypertension, maybe they're doing health fairs or on-site screenings at times, or including a blood pressure measurement as part of some larger health fair initiative. But there's really very little activity that I would call comprehensive or systematic, where hypertension has been the primary goal.
Right. So, for those employers that maybe don't currently have a strategy, but are interested in implementing something, could you outline some actionable steps that they could take to maybe enhance or really build a hypertension prevention or management strategy in the workplace? I think, like you mentioned, some employers might already have some things in place for other conditions. They might have, as you mentioned, screening services, but they might be looking for something a little more comprehensive and focused specifically on hypertension. So I know your coalition is working on putting together a guide that employers can utilize. So would love to hear some of the strategies that are included in that guide.
There were a few tools that are coming out of our work with the CDC Foundation. We've really been focused, as you said, on developing a comprehensive benefit guide for employers for hypertension. I'll also just mention there are other tools coming out of the work of the CDC Foundation. One of the first tools that I think is really going to be critical here is a budget impact model that will allow employers to look at what is the cost of hypertension for my workforce, both the direct cost, medical spending, and the indirect cost, lost productivity. And so before an employer is going to be willing to implement strategies that we're recommending, they have to first be convinced that this is worth their time. And so I think we need to continue, and things like this podcast will help educate employers that they need to be doing something about hypertension. So then the question is, okay, you've convinced me to do something, what do I do? And this is where our comprehensive benefit guide comes in. We've laid out 7 key strategies for employers to adopt. I'm not going to go through that whole list in great detail for you, but I'll say, let me hit on some of the highlights for you. So first of all, primary prevention is really critical. So primary prevention is helping people not get the disease. So we have over 50% of the workforce that's not hypertensive. What can we do to prevent them from becoming hypertensive? Well, we can certainly do everything that we're doing for other chronic diseases regarding lifestyle change, physical activity, healthy eating, support for mental health, etc. And we can't lose sight of that. I think of the work all the time of Dr. D. Eddington, who was for many years on faculty at University of Michigan. He's no longer with us. But Dr. Eddington was really a thought leader on worksite wellness. And what resonates with me to this day is he always talked about help people not get worse. That the goal of wellness programming. So the idea of people who don't have hypertension, do everything possible to help them live a healthy lifestyle so they never become hypertensive. And then for people who do have hypertension, help them manage their disease so it doesn't get any worse. So primary prevention and secondary prevention. So I think employers can play a role in helping to screen the population for hypertension. One of the alarming statistics here is only around 70% of people who have hypertension know they have hypertension. So if we can implement in the workplace screening programs and or encourage people to develop a primary care relationship where they have a relationship where they're seeing a primary care provider at least once a year, then hypertension at least can be diagnosed, and then we can come up with what do we do about it. And so thinking about doing health fairs, I know post-COVID, many people are going back to work, and then also encouraging people to get a blood pressure reading if they're not going to a primary care physician. We can provide blood pressure cuffs so people can self-measure blood pressure. And there's a whole program called SMBP, self-measured blood pressure, that promotes people measuring their own blood pressure and managing their own blood pressure. So that whole idea of screening, the whole idea of getting people into a good primary care relationship, benefit design. So I mentioned providing blood pressure cuffs. Another critical piece of benefit design is consider implementing value-based insurance design, VBID. So some of the listeners may be familiar with the work of Dr. Mark Fendrick and his colleagues at University of Michigan, the VBID Center, but they have compiled all the research they've done and other researchers have done that makes a pretty compelling case for employers to rethink benefit design and stop charging out-of-pocket payments or reduce out-of-pocket payments for high-value services. And we would say access to blood pressure cuffs, access to blood pressure medications, those are high-value services. So employers out there listening today, think about whether in your pharmacy benefit, you are charging people $10 or $20 copays or 20% coinsurance for hypertension drugs. And think about waiving that and considering hypertension drugs an essential preventive benefit that has zero copay. I know it will cost you something because now the patient is no longer sharing in the expense, but it's not going to drive up demand in terms of people who don't need drugs suddenly demanding hypertension drugs, right? And the whole idea is we're all trying to work together to get more people to take their drugs as prescribed and to be adherent. And so value-based insurance design is critical. Educating the workforce is also critical. So making materials available about, do you know what your blood pressure measurement is? When was the last time you had your blood pressure checked? If you've had your blood pressure measured and you have hypertension or high blood pressure, when was the last time you talked to a physician? Or are you taking your medications as prescribed? So lots of things we can do on education about hypertension management and self-management, and also just, again, the general ideas of healthy lifestyles, healthy eating, avoiding sodium, seeing the primary care provider at appropriate intervals. And so that education plays a critical role as well. So I think, Annie, the point of all of this is there are lots of strategies that employers can implement. And we would just say, start with something. Look at what you're already doing and see what else you could do. We know that employers are very hard pressed. Their time is valuable. They've got lots of different issues they're dealing with. A lot of the hypertension strategies are pretty easy to implement or to hold your health plans and vendors and PBMs accountable for delivering on. So employers, when was the last time you had a talk with your health plan or PBM or a vendor to say, what are you doing about hypertension, measurement, control, education, self-management, and try to get your vendors to step up their game so that it doesn't take a lot of extra effort on your part.
Yeah, I think, Neil, you are exactly right in that many of the things that you recommend in developing a really comprehensive hypertension strategy are, one, either things that employers are already doing and can maybe repackage, re-communicate in a way that's targeting hypertension, or they can really lean on the partners that they're already working with. So, really appreciate those insights and really looking forward to this guide so that employers have almost kind of like a checklist or a resource that they can look at and ask their vendors, ask their health plan, their PBMs, their solution partners, what are you doing in these areas, and where do we have gaps that you can help with, or what do we need to develop internally? And I think as well, business health coalitions like the BHC and the Philadelphia Coalition are here for exactly that support as well, to help employers understand where those gaps are at. So
yeah, I would also say one of the strategies in our guide is know your data. And so just start by looking at your own claims data. How many people have been diagnosed with hypertension? What is the adherence rate for hypertension medications? What are we already doing? What are we already seeing in our health risk assessment data or at our health fairs? And once you know your data, then you can continue to track those statistics over time to see if your population is progressing, if your strategies are having any impact.
Right. Data is so important in all areas of benefit design, but especially in this case. So like you said, you can see, the impact. I think that medication adherence especially is important to look at for those, in your population that currently have hypertension. And because that those medications can have a big impact as long as they're adherent. So could not agree more. As you continue your efforts to address hypertension, as a coalition with your employer members and the broader community, what can we expect in terms of your future projects or partnerships or things that you're working on? What's on the horizon in this space for your organization?
The next step for us, now that we've developed this comprehensive benefit guide, is, as you said, Annie, really to use it as a checklist. So we want to disseminate it, and then what we're hoping to do is get a group of our employer members together who are willing to use that guide as a checklist and start to make progress. We did a webinar a few months ago for our members to talk about these different strategies. And I was very happy to see that when we asked if any of our members would be interested in pilot testing the benefit guide and putting together an employer learning collaborative around hypertension and implementing the guide, how many positive responses we received. So for us over the next year, what we're hoping to do is get a group of employers together who are committed to implementing these strategies that we're recommending, and then tracking progress in managing hypertension. And we hopefully at a future date will be able to report back to you on was this guide, was uptake high and was usefulness high, and did it lead to improved health outcomes for the population? Because that's really what we're all about.
No, we would love that. I mean, that sounds amazing. I think, those actual employer experiences are what resonate the most with our members, and I'm sure other employers across the country. So, being able to learn from you all and everything that you're doing in this space will just be, so critical to the success of getting these hypertension strategies out to employers. One actually thought that just came to mind, as we were talking about data, I'd be curious as you were, kind of presenting the guide to your employers and trying to understand their interest in implementing this, was data something that they were excited about maybe diving into? Is that something that your coalition will be helping to provide them support, throughout this year? We hear from our members that, they have a wealth of data, but sometimes understanding how they can use it most effectively can be difficult. So would love to know if you're experiencing the same with some of your members, and if, this kind of year-long project will help employers understand their data.
Yeah, I think excited to look at their data might be too strong a word, but willing to, or seeing the value in looking at it. One of the other tools coming out of the CDC Foundation's work with FTI Consulting is, in addition to the budget impact model, we've put together a claims analysis guide for employers. So for those employers who want to look at their own data and say, what is the prevalence of hypertension? What is it costing me? We have all of the ICD codes and CPT codes and an approach that employers can use to look more closely at their own data. And so it'll be interesting to see what kind of feedback we and the CDC Foundation get on that tool.
Yes, very cool. That's wonderful. We'll be excited to see that as well and share it with our members. And, in addition to everything we've talked about today, just really excited to have had this opportunity to talk with you, Neil, and introduce this to our employer members. And, we'll stay updated on your progress on this important work. Do you have any parting words for our audience before we go?
I will just say that the St. Louis Coalition, as one of our sister coalitions, is wonderful. I hope your listeners appreciate how great Louise Probst and Annie Fitzgerald and the whole staff of St. Louis BHC are. And we learn a lot from your coalition. It's great to be able to return that favor to you.
That's wonderful. Well, we appreciate the collaboration, and thank you again so much for joining us today.
Thank you.
Thank you for listening to the Be Health Connected podcast. For additional episodes or to learn more about employer resources available through the St. Louis Area Business Health Coalition, please visit www.stlbhc.org.